The best way to alleviate symptoms due to myeloma is to treat the disease itself. Should a treatment either stop working or have side effects that the patient finds intolerable, that's a reason for us to find a new line of therapy. It's very important to maintain close communication with your physician, especially during that first cycle of a new therapy, as your body gets used to not only the treatments, but the other medicines that we use to prevent side effects. It's the high-dose chemotherapy that treats the myeloma, and then we use the stem cells to help you recover quickly. The most common side effects are hair loss, fatigue, and diarrhea. Stem cell transplant are what we used to call bone marrow transplants. We use stem cells that come from the bone marrow, and we now collect them through an IV in your arm to help you recover from high-dose chemotherapy. With the stem cell transplant, we're really rebooting the immune system, which leads to fatigue and low white blood cells that can increase your risk for infection. Steroids are a part of almost all therapies for myeloma. They really enhance the response to every other drug that we use. We dose it usually weekly. They tend to cause insomnia, increased appetite, increased energy. Patients will have one day of being very high and then one day of being very low, and then start to feel better in time to do it again. Proteasome inhibitors are very commonly used and generally very well tolerated, but it can cause peripheral neuropathy. It's very important that we pick up on any worsening peripheral neuropathy and adjust the therapy quickly. It can also cause constipation and low platelet counts, so the doctor will be checking the blood counts regularly. Monoclonal antibodies are the newest class of drugs that we have in myeloma, and they're incredibly well tolerated. Other than an allergic reaction, usually to the first dose, there are very few side effects. It's very important that you tell your doctor about any symptoms that you're having. Many times there are different options for treatment or ways to mitigate the toxicity.